So I think the main thing is just have consistent, concise messaging, and make sure that you're always sharing information from a trusted source. You know, social media plays a huge impact in the way the public reacts to an emergency. We saw this during Harvey with the run on gas. This is a very similar situation. We're seeing panic things being shared, not factual things. So share facts, not fear.
Thank you very much. Council, request from the audience to state your name so they get your names correctly.
Absolutely. So my name is Colin Davis, COLIN DAVIS, and this is Rachel Warrens.
I've got two questions. One question, one statement. One is, so what the message to our employees is: if you have fever, go home and contact your medical professional. What? Help me understand. What's that number? What's
the phone number for them to contact, or
a fever number?
Fever number. That's a good question. I have to go back and actually look at it. It's usually
100.5.
105.
100.5.
100.
And the other, after questions or whenever, it would be helpful to me with the city of Yoakum, just for kind of everybody to know how each entity is responding. If we could just kind of, most of us are around, what's Houseville doing, what's Yoakum, just so we all kind of have that.
That's what we're good on.
Thank you.
I want to interrupt you. There's no comments from God. You probably have things ready to go. Are you here for a couple hours, or?
I just add some time.
Okay, good. Thanks.
That's another one of the ways that you contact.
Alright.
With this is information we have for here. I mean, there's a lot of hype in this, and we're trying to digest it all.
Also, I know this was issued on a press release by the Offices of Emergency Management for Yoakum, DeWitt, and Lavaca counties. But I want to reiterate, I know there was some confusion about the patient that was here. If you, I feel like I'm about to stir the pot, but if you did eat at those restaurants in the time period that was articulated, you are not under quarantine. Or the people that might have been at those locations during the same time as our patient, they are not. They don't have to stay home. They don't have to isolate themselves from other people. They are a very low risk. Just out of an abundance of caution, the epidemiologists are asking that those individuals monitor themselves. So continue your daily lives and just monitor yourselves for symptoms. And if you start experiencing a fever or any unwell feelings, that you were at those restaurants at the times that we articulated, to call the number that I gave you guys, the 210-949-2121 number, and let the epidemiology group know, hey, I ate here, or I visited this restaurant, or I work there, or whatever, and I'm not feeling well, just so that they can be aware and give you some further instructions. But if you're not feeling ill, you know, that happened several days ago. And so if you're not feeling ill, you can just continue with your regular everyday life. I know that was very confusing, and I apologize for that.
One additional comment regarding that. The public should not have any fear with visiting either one of these establishments. So please, I mean, we know that this has had a financial impact to both of them. Don't shy away from it. There's no reason to. Questions?
My question, maybe you can answer, but can we talk about the patient himself, some of the particulars of the individual, maybe where he contacted this disease from, the already? We not at this time can't confirm that.
I can't share that information, I'm sorry. Okay. Yes, sir.
John Schultz, Block County Resident Service. The turnaround on the swab test is about 48 hours, correct?
So it kind of varies a little bit right now. If the testing is done through one of the LRN response labs, the turnaround time could be as little as 24 hours. Through some of the private lab vendors, we're hearing anywhere from 3 to 5 days currently. They are ramping that testing up, and those time frames we expect them to drop substantially. But currently, that's about what we're seeing.
I have a second question. The second question is, I understand that there's PPE from BSI, distributed to locations in San Antonio and Houston maybe. Do you know when that will be distributed to our racks, or how soon we can get that, or do we need to go retrieve it for our food service there?
So that's an excellent question, and that is my day-to-day job, actually. So the Strategic National Stockpile was requested by the state. The state did receive an allotment from the Strategic National Stockpile, and we did distribute that product yesterday. So the racks do have a small portion that they are working to push out to healthcare entities, including first responders and public health. I will caution you though, because this is a national epidemic, the amount of resources divided amongst all the states are limited. So the Strategic National Stockpile should be kind of your last resort effort for PPE, certainly not your first line.
I'm just wondering if we'll prioritize the locations that have been affected, or, you know.
I'm sorry.
Areas.
That current decision currently lies with the HPP providers, which in this area we kind of fall to STRAC. So they're the ones that have the prioritization of that. Randy, did you have something you needed to add?
I'd also like to introduce you to RNA Pius with the Texas Department of Emergency Management. Ernie.
Thank you. In regards to your question on the PPE, the process is going to be, as with any disaster or emergency, you try to buy it local, you try to find it, rent it. I know the supplies are out locally, check with your vendors. Once you discover that you do not have those resources available, then you need to contact your emergency manager. Your emergency manager will submit a state of Texas assistance request, a STAR request is what we call it, and it must indicate that you are unable to locate that resource locally. It will come to me at the disaster district there in Victoria. At that point in time, we will evaluate it for content, and we will submit it to the State Operations Center. The State Operations Center will then turn it over to the State Medical Operations Center. If the supply is available, it will be sent down through the RAC to the local jurisdiction. If it is not, you will receive an email indicating such, and that will actually go to the person requesting, which will be the emergency manager. So, two things. Number one, communication is key. We have to have communication between first responders and our emergency managers on a constant basis. And number two is keeping calm. This is no different than any flu. We were all taught to wash our hands when we were children. We were all taught to disinfect as the day goes by. So this is nothing new. It's just a different strain that's affected a lot more people. You have anything to add to that?
No.
Good. I'm done.
I've got a question for you, Ernie.
Oh, great.
Do I need documentation from my suppliers that my
Actually,
items
it's better or best to have documentation from your supplier that they are unable to provide that equipment to you.
That can even be, I'm sorry.
I was just saying along those lines, we're actually asking for that documentation to include two sources. So if you typically reach out to one, please reach out to another one and document that you're unable to obtain from both of those sources.
Should I submit the documentation with my STAR request?
I would. I would. Yes, back orders do count. Any other question for me? I'm hungry. Cool. Sure.